تمام؟ وصلنا فيها إلى الأنافيلاكسس. اليوم نكمل إن شاء الله من نقطة الأنافيلاكسس، ونرجع على المحاضرة اللي هي الإميون ديفيشنسي، the last subject. We can start right away. Good afternoon. Today we'll speak or continue with allergy. We start with anaphylaxis. Anaphylaxis is an emergency, very dangerous condition. The patient collapse is a systemic allergic reaction. And it is caused by degranulation of the mast cells and the release of vasoactive amines. Death may occur. This is very severe condition, especially if the patient has got a pre-existing asthma or adrenaline or epinephrine is not available or delayed in administration. The clinical assessment, we have to assess the severity and time between exposure and the appearance of the symptoms, and the potential triggers. What are the allergen, the route of exposure, whether intravenous, inhaled, etc. So if inhaled, the major symptoms will be wheezing. If venom or drugs, should be differentiated from the toxic effect or the side effect of these drugs. The clinical manifestation, as I said about allergy, is a type 1 hypersensitivity. It occurs in a few minutes, up to 1 hour. The main symptoms when it occurs, impending doom، وكأنما يشعر أنه المريض سوف يتوفى. Impending doom, it means death. Loss of consciousness, shortness of breath, generalized skin rash, itching, mainly where the rash and itching in the palms, in the soles, genitalia, and also the patient may have abdominal pain and diarrhea. المريض يسقط أرضاً أحياناً، بيغيب، shock-like. This is the anaphylaxis. On examination, you have to examine the larynx for obstruction, stridor, اختناق, tachypnea, angioedema of the lips, of the eyes, and the mucous membrane. زي ما حكينا, angioedema, it involves subcutaneous and submucosal, flushing, sweating, urticaria, erythema, widespread erythema. Patient may suffer from hypotension, wheeze, tachycardia, or even cardiac arrhythmias. These are the clinical manifestations, and you can see they are quite dangerous and quite severe, and they are systemic, involving the whole body. So you can see every part of the body is involved. Central nervous system, patient will suffer from this lightheadedness، يعني حس مثل راسه خفيف، يعني هيك مدى يركز. Loss of consciousness, confusion, headache, and anxiety. Respiratory, shortness of breath, stridor, hoarseness, pain with the swallowing, cough, gastrointestinal, crampy abdominal pain, diarrhea, vomiting. For the bladder, loss of bladder control. The patient may urinate on himself. Swelling in the conjunctiva, runny nose, lips, tongue, throat may be swollen. Heart and vasculature, imma tachycardia or bradycardia with low blood pressure. For the skin, hives, itching, flushing, pelvic pain. All these are, you can see, that it is a generalized manifestation. It could be sometimes not involving all these areas. It could be, but it can be generalized as general as these signs and symptoms. Management of anaphylaxis. Anaphylaxis is what? Acute medical emergency. I am sure you are going to face such problems in the hospitals, inshallah, once you graduate, and should be handled immediately without any delay. Prevent further contact with the allergen. Suppose the patient suffer from bee sting، يعني النحلة، لدغة النحلة، خاصة بالعمال اللي يشتغلون في معامل صناعة العسل، honey factories. Ensure airways. You may need endotracheal tube. Then administration, the most important point, first of all, intramuscular administration of adrenaline. How much we give? 0.3 to 1 ml, depending on the age of the patient. Usually 0.5. Usually 0.5 ml of 1 in 1,000 solution. You can repeat the dose in 5 to 10 minutes if there is no adequate response. Then administration of antihistamine like chlorpheniramine, 10 milligram intramuscularly or slowly intravenously. Remember, antihistamine, adrenaline, then antihistamine. The doses مطلوبة من عندكم. لأنه this is emergency, you have to know the doses and the route. And the route. Adrenaline intramuscularly, look. Antihistamine intramuscularly or intravenously, but slowly. Corticosteroid, also hydrocortisone, 200 milligram intravenously. This will help the delayed symptom, the later on symptoms. Just 1 second, please. Supportive treatment, the treatment that are supportive, nobilized beta-2 agonist will make the condition more. There will be a bronchial dilatation because the patient suffer from a bronchoconstriction. So if you use nobilized beta-2 agonist like salbutamol, which is Ventolin, or terbutaline, Bricanyl, are short-acting bronchodilators. Intravenous fluid, of course, the patient is suffering from shock. You have to put him on intravenous fluid, oxygen, and keep the patient on intensive care unit for 12 hours at least. Patient with anaphylaxis should be admitted to the ICU. And even the patient gets better within a few hours, you should keep the patient for 12 hours because there may be a rebound or delayed signs and symptoms later on. You may discharge the patient, and once he reaches his home, may get other signs and symptoms. So remember, there are delayed signs and symptoms which should be addressed. The patient should be referred for a specialist assessment. After you stabilize the patient, next day, the aim is to identify the trigger factor, what precipitated the anaphylaxis. Educate the patient for avoidance. The most important step in a treatment of allergy is avoidance and possible immunotherapy. And the patient will be provided with self-injectable adrenaline called EpiPen. This is EpiPen. Such patients handle these EpiPen in their pocket in case that may suffer from anaphylaxis at any time from any cause, and his family know about it, and they could inject the adrenaline immediately because it is a life-saving drug. Some patients have medic alert or card or a bracelet زي السوار carry with the patient, which may indicate that this patient suffer from anaphylaxis from so and so. How we investigate allergic diseases in general. We finished with anaphylaxis, but investigation. The gold standard is a skin prick test. This is a skin prick test. You put the allergens on the forearm, you inject them intradermally or at the back. And you use positive control and negative control just for comparison. And here we use drops of diluted allergens, either on the forearm or on the back. And these drops can be inserted intradermally by lancet, يعني هيك زي الدبوسة, or by a special skin prick test device. A special skin prick device. After 15 minutes, you can read whether there is a wheal and a flare around the injected allergen. Antihistamine should be stopped before the test, 4 days before testing. You can see this is the skin prick test device, multi-puncture, and this is by the Lancet. And you can make pricks and you can write on them certain codes and put positive and negative control. The positive, they will appear like that, red, within 15 minutes. Also, we can test a specific IgE test by ELISA and previously by radioimmunoassay in a test called RAST. It is not anymore used nowadays, except in a few laboratories. So a specific IgE test. What is the specific IgE test? You test IgE against the allergen. IgE, for example, against the grass. IgE against house dust. IgE against house dust mite. IgE against food stuff like milk or egg, etc. Also, the total serum IgE and eosinophilia can be tested. The total serum IgE in our locality is not important because it is high anyway due to environmental factors and due to high prevalence of parasitic infections. Normal IgE does not exclude the diagnosis. Eosinophilia is common in atopic individual, but it is not more than 20%. Challenging test, you expose the patient to the allergen that is claimed to be the trigger of the allergy. يعني مريض مثلا عنده allergy من certain food like tomato. You expose the patient to, you can rub his lips with tomato and then you see whether there is reaction or not. If it is occupational, you can expose the patient to the allergens like textile allergens. But this should be done in special centers because it is very dangerous, may trigger anaphylaxis. For example, if a patient suffers from asthma or food allergy, you can expose the patient for these allergens. The most important test nowadays available is called the mast cell tryptase in the serum, which will be high within 1 to 2 hours of exposure and remain high for 24 hours. It measures the tryptase at 0 time بعد 3 ساعات after 24 hours. يعني ناخذ sample بعد immediately from the patient, okay, after 3 hours, and after 24 hours, then the tryptase will decrease. It remains elevated for 24 hours. General management of allergy, in general, avoidance, we said the most important and the main step, I repeat it again, in the treatment of allergy is avoidance. Antihistamine, which block H1 receptor. As we said, we can use long-acting, non-sedating preparations, as I mentioned, fixofenadine, etc., loratadine. Corticosteroid decrease the pro-inflammatory cytokine. They can be used also topically to minimize the side effect. And they are useful for the delayed symptoms, rebound symptoms. Serum chromoglycate, mast cell membrane stabilizer, can be used for prophylaxis. In asthma, we use inhaler called Intal. Allergic rhinitis, we use nasal spray called Rinachrome. For allergic conjunctivitis, we use eye drops called Optichrome. All of these preparations are sodium chromoglycate. What is sodium chromoglycate? Mast cell membrane stabilizer. حتى لا يصير عندنا degranulation. Antigen specific immunotherapy, or called hyposensitization, or called desensitization. It is carried by giving subcutaneous injection of an increasing amount of the sensitizing antigen. Suppose a patient is allergic to house dust. You give the patient subcutaneously every week or every 3 days injection subcutaneously of the house dust in an increasing amount. For example, you give first dose 0.1, second dose 0.2, third dose 0.3, increasing the dose, aiming to generate blocking antibodies of IgG type. It is used for treatment of allergic rhinitis and allergic asthma, and stinging hypersensitivity, اللدغات, for example, bee stinging, يعني لدغات النحل, or wasps, الدبور. But this technique is not used for food allergy or chronic urticaria or angioedema. Not used for food allergy, chronic urticaria, and angioedema. Also, you can use omalizumab, which is called Xolair, is a humanized monoclonal antibody, IgG1, that inhibit binding of IgE to mast cells and basophils. So this prevents the IgE from binding. Once you prevent the IgE from binding, the allergens cannot bind to it. I leave you with the 3 videos which may explain what I have said to you. Very interesting video. I recommend them to be seen. This is just review. It's not part of this lecture for you. The degranulation process in the mast cells, the antigens, IgE, the receptor for IgE. There are the preformed mediators، يعني جاهزة هذه الميدياتر الفازو اكتيف امينز معناتها، اللي هي الهستامين وبروتيز كيموكاينز هيبارين، هذه موجودة داخل الماست سيلز. في ميدياترز أخرى نيولي فورمد تتكون بعد التريجر، بعد حصول الالرجي، اللي هي البروستاجلاندين، لوكوتراينز، ثرومبوكسينز، بليتلت اكتيفيتنج فاكتور. فاذا الميدياترز بري فورم ونيولي فورم، هذه ماخذيها انتم بالاميونولوجي سنه ثانيه بالimmediate hypersensitivity. We have got a test ايضا هذه you have to know it called nitric oxide test. It is the exhaled nitric oxide، يعني المريض يتنفس بهذا الجهاز. put his mouth here ويتنفس فيه. هذا الجهاز نطلب من المريض يعمل زفير exhaled breath. Then you check the amount of nitric oxide gas. E here, the letter E, it means exhaled. Nitric oxide is present normally in the exhaled breath, but in low amount, 20 to 30 parts per billion, ppb. But in asthma, it will be very high. So this indicates airway inflammation, which is a sign in asthma. So if the nitric oxide test is high, this patient support the diagnosis of asthma. Any question about allergy? If not, we will